My name is Liz Creamer. I'm a physical therapist. I've been a therapist for 28 years. About 10 years ago, I took a couple of dry needling classes with another provider, and this is my first Myopain seminar. It was advanced dry needling and dissection. A fabulous experience. We got to dissect and needle and see if our needles went where they were supposed to go. Just absolutely fabulous.
Hi, I'm Jonna.
I'm Jackie.
Shara. And Jen.
We're 4 physical therapists who work together in Virginia. And every year we try to take a course together. This year our course was here with Myopain Seminars in the cadaver lab.
Utilizing the cadavers to increase our confidence in our skills to know exactly how we're doing and how accurately we're doing it was an absolute benefit from taking this course. Having the educational teachers of the cadavers being able to show us exactly what we're needling and how we're needling it and how dense the fibrous connective tissue is and how far it runs throughout multiple muscles. Just being able to see that live was invaluable.
I'm Jonah. I have been practicing acupuncture and dry needling for about 20 years. I have gone through the Myopain dry needling program, which I thoroughly have enjoyed and benefited from. I wanted to say a few words about what a privilege it's been to have the opportunity to learn the anatomy directly from the cadavers here with Jan and Tracy and with the experts here at the cadaver lab.
Tracy and Jan were the instructors, and the knowledge of anatomy, the precautions of what we need to do with dry needling, the technique of dry needling, the technique of myofascial needling was just a real great experience for me. I can't wait to get into the clinic and use some of these techniques.
Hello, I'm Kelly Soring from Minnesota. I'm an occupational therapist, and I started dry needling 3.5 years ago. It's really expanded my practice and helped me with faster and more effective treatments with my patients. And I really was interested when I heard about the dissection because I felt like it would just make me more specific and effective in my treatments with my patient. And I was not disappointed at all since I've been here. It's been amazing. I've got to see just some complexities in the body that I have only dreamed of seeing one-on-one with cadavers. I've also been able to take the stuff I learned in school before, the stuff I've applied in my practice, and kind of bring it all together. And one of the most significant things for me has been just returning to cadaver work with the things I see in the clinic, and then being able to kind of extrapolate what's going on in the body when I'm treating pain. Especially one thing is the fascia systems. When I previously did cadaver work, I wasn't aware as much of fascia systems, and now just seeing what I'm seeing today just really gets me thinking and questioning, am I treating the fascia enough? And what else can I do to make my patients better? So I'm forever grateful for this course, and if you're thinking about signing up, I would 100% recommend it, and thanks for listening.
Yeah, so it was really interesting to see the myofascial planes and how those myofascial planes really traveled throughout the body, and some of the differences in anatomy, just the placement of the muscles itself, sometimes especially having the 3D dimensional aspects of it. Especially like the suboccipital muscles, really seeing how they were oriented. When you see them in a book, it looks very different, but seeing those relationships. Also really seeing when you're needling, being able to see those structures that you need to be careful of, and really knowing where you're going with those. Got to see some of the how the fascia moves with needling, which was quite interesting. We also, a little bit away from musculoskeletal that a lot of therapists tend to be really focused on. We were able to open up the brain and really see the brain and how it sits in the skull, differences in shape of the skull, and who knew how scoliosis could affect actually the shape of the skull. We did really great dissection at the TMJ, which was really interesting to see lateral pterygoid, medial pterygoid, where it is in relationship to the zygomenic arch. Yeah, we even got to see the disc. It was very interesting.